Usually, health sector reform happen when there is the big problem. There is the big issue why certain health sector need to be reformed. It is because of the most of it because of the economic pressure. So economic pressure on the government and specifically on the health sector have forced the government of developing countries to initiate the HSR, the health sector reform. So bila economic terbeban, usually it will affects our health system. So the government usually they akan buat reform in order to ensure that the appropriate share of public fund is spent on healthcare, especially at local levels. And also, this reform need to be done in order to improve the organisation, management of the health system, and ultimately to achieve the overall health policy objective. So as a user, kita ni sebagai user, of course we want to have a very good, we need to receive a very good healthcare in our own country. So as user, we always satisfied with the form and content of the health services offered in order to improve our health and also status and class certification. And also as a user, we want to get the benefits of our publicly funded healthcare and equitable distributed in order to improve the equity of access to care. Sekarang ni kalau kita tengok dari segi healthcare ni, it, it's like a competition, right? Especially from the private sector. Banyak sangat and also the insurance. There's a lot of package. Because people, it's demand from a user. Now we want to have a very good the facilities, a very good services. Somehow isu healthcare ni dah menjadi satu orang kata it's a competition from every part of people that involved in the health system. Yeah. So there are three types of reforms where number one is changes in financing methods. Number two is changes in health system organization and management, and also a public sector reforms. Yeah. So kalau kita tengok selalunya bila berlakunya health sector reform is because of the political policy cycle. It started with the problem definition. When they come out with problem definitions that it will go in terms of dari segi etika, they will diagnose. They will get, this is the problem of the our health sector. We need to diagnose it, and from this diagnosis they come out with the policy. As we know that polisi ni selalunya dibangunkan adalah berdasarkan kepada situasi terkini untuk menyelesaikan masalah recent or in the future. So from this policy development, political will make a decision in order whether they want to have a reformation of the health sector. And if they agree, the political decisions usually they will discuss in the parliament about the reformation, and they will implement. And also after the implementation, they will look at into the evaluations whether the reformation that they have been done is effective or not. So these are what we call as the political policy cycle in terms of the health sector reform. However, if you want to do a reform, it's not an easy task. It's because it involves a lot of people, it involves a lot of procedures, it involves a lot of mechanism, and etc. So when we want to reform, there is very unclear who has the power or responsibility to reform the health sector. Is it the Minister of Health, or is it the Medical Association? No, or the health insurance itself is responsible for the reformation, or us, kita semua ni as a citizen. And so this is a power divided among groups interest. A doctor wants more freedom and more resources. Health insurers pula want more control and less spending. They, of course, as political, they want quick changes. And as a public health specialist, its focus is on her health promotion. So why is very successful to get a reformation difficult? Because of the consequences of actions are difficult to predict. We don't know that whether the reformations that have been made is a good reformation. Okay, that's why kalau you tengok dalam political cycle tadi, it's very important after you implement, you have to evaluate whether the reformation is successful or not. And when we talk about health system ni dia banyak agensi yang terlibat, banyak komponen yang kita lihat tadi, and it has many multiple goals. And doing better on one goal dimensions may mean doing worse on another. So the choices to do a reformations are very difficult. And sometimes those who benefit from the system are powerful and resist to change, and those who benefit from change are often less powerful. Itu adalah perkara biasa if we want to do a reformation, and countries are limited by the economic and also by administrative capacity. Ni adalah kenapa salah satunya is very difficult to have a successful reformation. Jadi, the main goal untuk health sector reform adalah pertama adalah equity. Yang kedua adalah kita tengok dari segi efficiency of the reform, the quality of the reform and the sustainability reform. So, they are the four main goals when we want to do the HSR. Equity, efficiency, quality and sustainability. Okay. Selalunya kan apa yang menyebabkan what starts the cycle reform? Macam saya cakap tadi, usually cycle reform ni bermula dengan bila ada mengalami masalah dari segi ekonomi, crisis of economy. So when they have a fiscal and economic change, which is crisis or opportunity, then there will be a starting point of the HSR. And followed by sometimes also political change, bila berubah kerajaan and also the crisis and opportunity, then there will be a HSR. The external pressure dalam kalangan orang kata inside the health system itself, the people inside the health system, the medical association, the insurers and etc. Also can affect the reform. And also we can say that unhappy interest group also can effect in terms of starts the cycle of the reform, and the inspired leadership usually not rational analysis why there is start of the cycle reform. Okay. So again, the health system reform cycle sama juga macam political cycle is define the problem, and then why they define the problem, and then they will identify what the causes, apa yang menyebabkan we need to reform our health sector. They develop the options, banyak options yang dibuat, and decide what to do. After they get the options, and of course they have to decide what to do, they implement, and lastly they will evaluate. It is different with the political cycle just now. Bila we talk about the health sector reform, it started, they define the problem. After they define the problem, and then they have to identify the root causes of this problem. Then after that, they come up with options. Apa options that we need to do, that we need to identify, we need to justify. We need to do changes, we need to do a reformation. And barulah they decide what to do. There are many options, then decide what to do. They implement, and of course it must be evaluate at the end of the implementation. So tadi dia berbeza. Ini yang tadi political policy cycle. So kita tengok dari segi ekonomik dan juga health sector reform satu-satu. It's very good question here. Kita nak tengok, if someone asks you to find one problem of all human, which is the most important to them? Kalau kita tanyakan mana-mana saja orang kat klinik, then what problem is the most important to them? And then they will say that money. Money is the, orang kata, is the all human, the most important to them. And what problem do you address? Selalunya kita akan tengok mereka ni akan cakap the needs, the wishes they cannot reach if they don't have money. And if you are someone, if someone asks you to find one problem of all governments which is the most important to them, okay, what do you say? Okay, they will say that people needs they can't meet. Okay, which is apa kalau kita kata kita one problem that government facing that dia tidak boleh memenuhi kehendak semua orang. Okay, this is always the answer that we see, which is because of the lack of money. As a human, we demand, okay, kita need which, this is our wish. We need a very good facility. We need a very good, orang kata, government to cater in terms of our healthcare system. But of course, they will say that the people needs they cannot meet because they have a lack of money. Okay, they're dancing about that. Okay, so for example, dengan meningkatnya populasi dunia sekarang ni, maka there is a lot of demanding, there is a lot of orang kata expand from the government in terms of the healthcare system, into the healthcare system. So if you have, how do you do with if you have 1,000, it's 100,000 ringgit, and you divide it into 5 people last time, and then you divide it into 1,000 people, and you divide it into 1 million people. Of course, makin lama, okay, makin kurang setiap per head people to get the money from that 100,000. So it means that it's nowadays again the pressure on our health system is based on our economy. And there's a lot of people, and every people they have a different desires, they have different preferences, they have a different behavior, and they have also important certain important issues that need to be tackled. So the governments have to look at everything, the needs of the people. Okay. Dari segi management pula, okay, kalau kita dalam hospital itself, they want to plan to reform and change, they have through 5 control knobs, dari segi orang kata financing, dari segi payment, dari segi market organization, regulation and persuasion. So this is dari segi management, kalau dia nak change, they have to go for the 5 control knobs ni lah, FPMRP, dari segi kewangan, dari segi insentif, dari segi orang kata organisasi mereka, dari segi regulation and also depression their behavior.